Calgary Elbow.
Thank you, Mr. Speaker. Last spring, the Auditor General released a comprehensive look into Alberta's healthcare system. Instead of making new recommendations, he simply took the 41 recommendations he'd already made and summarized them. His conclusion: Alberta's $21 billion healthcare system is an orchestra without a conductor, which led to poor coordination, ineffective information sharing, and fragmented hospital-focused care. To the Premier, what specific actions have you taken to break down barriers in our healthcare system and build a preventative, integrated model of care?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I'm incredibly proud of the work that we've done with healthcare professionals. There certainly have been musings about transformation in the past, but they were done in a way that was certainly doing something to the profession rather than with the profession. And what we've been able to do very effectively is bring about a new governance framework with primary care networks, Mr. Speaker. That is something I'm incredibly proud of. Physicians stepped up to the table with us, as well as other members of the primary care network team, and we're being able to move forward in a way that's collaborative, working to make sure that the patient health home is the model we all have moving forward, Mr. Speaker.
First supplemental.
Thank you, Mr. Speaker. The Auditor General found much of the care Albertans currently receive is one-off and focused on acute care, either in a doctor's office or in a hospital. But there is a big gap when it comes to managing chronic conditions, including mental health, over the long term. Instead of measuring quality, the system focuses on funding parameters, on union negotiations, and it puts bureaucratic rules ahead of patient needs. Equally troubling is his comment that politics continues to play a big role in our system. Again, to the Premier, what specific, measurable actions are you taking to address these problems once and for all?
Minister of Health and Deputy Premier.
Mr. Speaker, I'm very glad to have an opportunity to respond. I took the time to sit down with the Auditor General as well and talk through his report and his recommendations, and he did have a lot to say about inflammatory opposition questions that certainly cause great disruption to the system, Mr. Speaker. I hope they also took time to sit down and talk to him about that same evolution of the healthcare system. I'm incredibly proud of the fact that for the first time, and probably since AHS was created, we are moving forward in a collaborative way with the healthcare provider, with primary care networks, with the government to ensure that we have the right care in the right place. And a big part of that is the evolution of the PCN model and working with Alberta Health Services.
Honourable Minister, second supplemental.
Well, that's interesting, Mr. Speaker. The Auditor General called this government's actions piecemeal at best. You'd think after 2.5 years they would at least have started on a plan. And speaking of plans, the AG said the government should urgently address the overlapping roles of AHS and Alberta Health. Simply put, Alberta Health should hand over a lot of responsibility. But I suspect this ties into his comment about politics, Mr. Speaker. Again, to the Premier, when will we finally see a plan to implement the Auditor General's recommendations? And when we do, will it include clear, measurable goals so Albertans can track your progress?
Honourable Minister of Health.
Thank you very much, Mr. Speaker. And I was very happy to meet with the Auditor General. Again, this specific report doesn't actually have recommendations in it. It has a number of different findings, and we're happy to move forward in collaboration with the Auditor General to do that while making public health care publicly accessible to all Albertans. We know that the opposition wants to privatize health care. We believe health care should be based on medical need, not based on the size of your wallet. We know that Jason Kenney and the opposition plans to give his wealthy donors priority access to health care, Mr. Speaker. That's been made clear, and we are building new hospitals, protecting Albertans throughout this province. I know who I trust with public health care, and it sure isn't the guys opposite.